first and foremost, we want to focus on people leading healthy lifestyles. So that comes down to proper diet and exercise. The second thing that we really focus heavily on is vaccination to avoid all of those pesky diseases. I would say the number one thing that we can do as far as prevention, and this goes for a lot of different conditions, from chronic disease to infectious disease, is focusing on proper eating habits, as well as getting the recommended amount of physical activity. Other things can include hand washing. That's been known to decrease the risk of respiratory diseases, decrease the risk of enteric diseases, and is a very easy and common thing that individuals can do. And then, one of the other pieces is focusing on a vaccination. I think that, we have, as a cornerstone, the ability to vaccinate people against diseases that we've eradicated in the past. And so, we see very few, cases of measles in the United States as one example. Now that is increasing in recent years because of the measles virus making its way into susceptible populations within South Dakota and other locations. But vaccination is one of the cornerstones of public health. I think the biggest disservice that we can do to ourselves is carrying on as usual when we feel sick or when our kids are sick. The downside is that a lot of times, if you're working in an hourly wage job and you need to get your kids to school, you're pushing yourself into that work environment when you're sick. You're pushing your kids into school when they may be sick as well. And so we do need to have a stronger focus on individuals staying home, and the corollary to that is having a social system that allows them to stay at home when they're sick.